mother became ill with dementia and other serious healthcare needs, he found himself in a 2-year battle to secure what is called continuing healthcare funding to pay for her care requirements. He eventually got £200,000 of retrospective payments for his mum's time in a nursing home. He now says that tens of thousands of ill and vulnerable people have been unlawfully denied this continuing healthcare funding that they're entitled to, and he's bringing legal action to ensure that more people can access it. He believes that if his legal action is successful, it could cost the health service £5 billion in back payments for medical needs. Let's talk to Philip now from his home in Portsmouth. Hello to you again. We first heard from you, Philip, when we reported on the scandal about continuing healthcare, on people being denied continuing healthcare funding back on our programme several years ago. For those who don't know, tell us first about your mum and what happened to her.
Okay, I think it just might be worth, if you're happy for me to explain what continuing healthcare is.
Go ahead.
People have muddled it up with the closely related issue of social care funding, and they are distinctly different. So social care funding is essentially for the elderly and frail, but people who don't have a serious illness, and that's means tested. So that's either paid for the local authority or privately funded. And of course, there's a big debate about that. That should be reformed, and Boris Johnson has promised to do that, and successive governments have failed to do that. But continuing healthcare is about health and not wealth, and it is the statutory legal requirement of the NHS via the clinical commissioning groups, the sort of local NHS organisations, to fund healthcare outside the hospital setting in any location, whether that's in a person's private home or more normally in a care or nursing home.
Yeah, and it's not means tested.
And it's not means tested because healthcare is free at the point of use. So that's the founding as well, the NHS. But there is massive evidence to show that actually the NHS and the CCGs are acting unlawfully and denying tens of thousands of old, ill, very ill and vulnerable people the healthcare funding to which they're entitled. And the result of that is that these people often are the most vulnerable people in our society. They often deplete their entire life savings and are forced to sell their homes. And it's not just me that thinks that. There is overwhelming evidence from expert public scrutiny bodies. For example, the Parliamentary House of Commons Public Accounts Committee, the National Audit Office, the Care Quality Commission, the CHC Alliance, 17 charities related to this business.
Understood. So let's just focus in on your mum, because people will be able to potentially, for the first time, realise that they might be in the same scenario as you and your mum. You stumbled across that this was available. You know, as you say yourself, often described as the best kept secret in the NHS. It was a battle to get it from your local clinical commissioning group. Why was it so hard? Is it because the criteria is so narrow, or because, you know, your mum didn't tick one box when she ticked 9 others? Why?
Okay. Well, first of all, the system is massively complex and well beyond the average member of the public to understand. And, you know, I had to become an expert on the 160-page framework. So CCGs that are operating aggressive and unlawful CHC regimes use that complexity to exploit and confuse people. This isn't all CCGs, just a fair portion of them. And, you know, I had to navigate my way through that. It took me 2 years, 100 letters, 3 meetings, and at an appeal panel, the chairman agreed with me that actually the Wiltshire CCG had contravened the regulations in multiple ways. And I then detected a Care Quality Commission inspection report that determined that Wiltshire CCG had one of the lowest award rates in the country.
Okay, I need to get on with the story. I'm so sorry, Philip, just because time is against us. I'm so sorry. I know it's frustrating. So anyway, you won that battle. I mean, it was blooming hard work, but you got it in the end. Let me just say what an NHS spokesman told us. CHC funding is available to a minority of people whose eligibility is assessed on an individual level, whilst most people are instead covered by the rules on social care eligibility that Parliament has established. Now, you say these individual assessments, they're turning down people who are actually eligible. How can you know that? Is this what this legal action is about?
It is, but it's not just me that knows that. It's the expert scrutiny that I've just described. But the evidence and the NHS and the government are extremely disingenuous about this. That since 2015, rather than the previous steady rise in eligibility rates, they have sharply fallen when the ageing population would determine the fact that the eligibility rate should increase. But the biggest element of this scandal is what's called the postcode lottery, where the variation in the award rates across the country is huge and unexplained by socio-economic and health and wealth demographics. Could it be, and I'll have to ask you to be brief, Philip, I'm sorry, could it be that clinical commissioning groups, local NHS clinical commissioning groups, are turning down more people than they're awarding this to because money is tight? Yeah, sure, money is tight, but the fact is they are breaking the law. And if the government don't think CHC is affordable, they should change the law and not break it. But they won't do that because they would be compromising the founding principle of the NHS that healthcare is free at the point of use. So that is politically unacceptable. So they're having their cake and eat it. So either they fund it properly or they change the law and they won't.
Understood. And in terms of you taking this legal action, it could be really expensive. I know you're crowdfunding.
Yes, yeah.
Are you going to be able to do that?
We've had a good start. In about 4 days, we've achieved £20,000 of the initial £30,000 target, but we'll need a lot more money than that. So I would appeal to your viewers. They might not need CHC now, but I can guarantee that in the future, one of their family, friends, or loved ones will. And this has significant financial implications. So please look at my Crowd Justice platform and contribute to that. Just key in CHC scandal of my name and it'll flash up, and that will give your readers or viewers rather a far more comprehensive overview of this scandal, which is the biggest public scandal of modern times, measured by the tens of thousands of old, ill and vulnerable people who have been absolutely unlawfully treated, and this sheer scale of the finances, which is why this legal challenge is going to be lengthy, complex and expensive, because the NHS and the government will not want to lose this case because it would cause significant reputational damage and also huge financial liberty. But we can't...
Philip, you've explained it incredibly brilliantly. I didn't expect anything less. Thank you very much. Thanks for talking to us and for explaining it.
And thank you for the opportunity.
Not at all, that's why we're here. Philip Mathias, talking about what he calls the continuing healthcare scandal.